We support the tobacco tax because it's not only good for Arkansas, it's good for older people. Older people want to stay in their own homes as long as they can, and the cigarette tax will help them do that because it funds services that help people receive care in their own home where they want to be.
The funding would allow us to provide access to quality primary and preventive health care for many more people. And in Montgomery County, right now, because of the amount of uninsured patients that we see there, it's going to save that clinic. It's going to keep that clinic in operation, and we are the only other doctor in the entire county, and there's no hospital in that county. So we are one of two games in town. The dark side in Montgomery County is that the available funding will run out in August or September. And so we will leave about 1,500 patients without a doctor and a dentist. Those are all people that are currently collecting a paycheck and contributing to the economy of Montgomery County, and they'll be going somewhere else. So that facility will in fact close.
The emergency care that I got one day was really, really important. I had a heart arrhythmia, and the community health clinics rushed me right in and stabilized my heart, and then got me in an ambulance and got me to a health center in Hot Springs. So it was really important. If we don't have that kind of access, then we're in trouble. Plus, it's affordable.
I had a heart attack about a year ago, and again, it was the Family Health Center that has just came to my rescue and has helped me to really cope with and understand a lot of the medical changes that have happened with me. And when I heard about those that they were talking about possibly closing, it grieved my heart, because I said people don't really know, those that make decisions don't really know the importance and how necessary they are to people like ourselves, that if it wasn't for those centers, we don't know what we would do, because literally they really have been our lifeline.
The funding is going to allow you to start to build new facilities. Once you stabilize what you have, you can start to build facilities in areas like Fountain Hill, like Star City, like Dumas, these places that are extremely poor and have been for many, many years. And they deserve the same health care as you get if you live in West Little Rock.
To a rural legislator, I would say, please pass this legislation. Our counties in these areas are desperate, and I underline the word desperate, for health care. At one point in time, there was no doctor in Montgomery County at all. We need these community health centers.
Please pass the bill that will aid the family health centers. We need it, and we need what they can provide for us.
If you're a legislator in Osceola or Blytheville, support of this tobacco bill will allow East Arkansas Family Health Center, a community health center, to come into your county to provide care for those that are underserved, uninsured, and provide additional uncompensated care.
Well, my message to state legislators would be invest in the health care of Arkansans. It is a shame that we end up being ranked so low in health care when all the rankings come out. That's not real. We need to do better by our citizens, and I would urge them to provide that necessary funding.
Support this bill because it will help older people stay in their own homes as long as possible.
In my case, we're talking to people like Senator Larry Teague and Representative Bill Abernathy, and I'd say the same thing to them that I have said to them over the last 6 months, is that we need their support for this, that this is a make or break situation. We'll never get an opportunity like this again, and we need them not only to support the legislation, but to support our efforts to convince other legislators to get on board with it. So we're trying to create a snowball effect, and hopefully with today's kickoff, they'll see that the light and move forward with it for us.